Hello, my name is Dr. Sandy Hardee, and I'm the Medical Director of Occupational Health Services for Prisma Health. I'm going to do a talk today about hearing loss in the occupational space. As you know, we work with a lot of companies that manufacture products, and in that space, there can be loud volumes, a lot of decibels that could potentially cause hearing loss. So that's going to be our topic today. This is actually a really common problem. I knew that there was a large percentage of workers that are exposed to hazardous noise. It's about 17%. There's also a large volume that are exposed to solvents that can actually damage the inner ear. They're neurotoxic to the ear. I didn't realize that this is the third most common chronic physical condition after hypertension and arthritis. That was a surprise to me. So I'm going to talk about hearing testing. A lot of folks out there watching this are familiar with that. If you're a safety manager, you're very familiar with it. Most companies in a manufacturing setting will, depending on what the levels are in that plant, may have to do annual surveillance and a hearing conservation program. There are different types of hearing tests. The most common is what's called a pure tone hearing test, where the individual either sits literally in an audio booth, wears headphones, and there's a machine that will produce a sound at a certain decibel and a certain frequency. And when that individual hears that sound, they'll state yes or they can raise their hand. So that machine goes through a series of frequencies, and when you can hear the sound, depending on how loud it has to be, you notify the individual or the machine that you heard it, and it plots out over time what your audiogram or what your hearing is in that space. The machines that do the testing now are more sophisticated, so they have very good noise canceling devices with these machines, so you don't need necessarily the audio booth as long as you have a quiet room that you can do it in. So that's made this process a lot more portable. To give you an idea, when we talk about decibels, that's the level of volume, the level of sound. So when someone's whispering, that's about 30 decibels. Normal conversation is approximately 60 decibels. Anything above that, you're getting in the very loud to painful decibel level. So, for instance, a jet taking off or a rock concert would be in that 120 to 140 decibel range. So in a manufacturing plant, it's very easy for them to get into this 85 to 90 decibel level and definitely want to have a good hearing conservation program in place. So I'm going to show you what a normal hearing test looks like. So along this vertical axis, we have the decibels, and along this horizontal axis, the frequency. So typically there are 6 frequencies that we'll test at, beginning at 250 and going up to 8,000 hertz in frequency, and the decibels along this vertical line. So the red indicates the right ear, the blue indicates the left ear. You can see these values are in the normal range. So this means at 250 hertz at that frequency, the left ear they heard that frequency at 10 decibels, the right ear at 5 decibels. They swapped for the 500 frequency. They were the same decibels here. The right ear required a little more decibels, 10 versus 5 in the left. Here we got a little above 10 in the right, 10 in the left, and then it changes again, which is fairly common pattern. But you can see here there are levels of hearing impairment. So there's normal, mild, moderate, severe, profound. 26 decibels up to 40 decibels is considered mild hearing loss. 40 to 60 is moderate. Anything higher than 60 decibels is considered severe hearing loss. So as I look at the next slide, this is an abnormal hearing test. The right ear at 250, 500, 1,000 hertz frequency only requires 10 decibels for that person to hear it, but then at 2,000, 4,000, 8,000, it's requiring higher volume or higher decibel of that frequency to hear it. So about 25 decibels, about 30 decibels, and about 40. So in this patient, I would say that they have mild hearing loss at higher frequencies in the right ear. In the left ear, you can see right away there's a decline in their hearing. So in this individual, I would say that the individual has mild, moderate, and severe hearing loss in the left ear beginning at 500 hertz up to 8,000. So you can see there's a discrepancy here. So once we get a baseline on someone, then each year when we repeat this, we can see a pattern. We can basically kind of overlay these audiograms on each other and see if there's been a shift in their hearing capability. So remember, once you have a hearing loss, it is permanent. Uh, Temporary hearing losses would be caused by things like wax impacted in the ear that needs to be extracted. If someone has fluid in the middle ear from allergies, or if someone has an infection in the middle ear. So there are some things, if someone has a simple upper respiratory infection, when they do this test, they may have some fluid that may affect it. So it's important to know that when you do the test. If they do have some fluid in the ear or an upper respiratory infection, we generally wait at least 4 to 6 weeks and then repeat the test. It's helpful if you have a clinician there that can examine the ear to see what the eardrum looks like in those cases. So hearing loss, as I said, it's important to perform an annual screening to monitor. And what we're looking for is what's called an STS, a standard threshold shift. This is a change of 25 decibels or more in a audiometric zone or hertz. So um, if you do notice a 25 decibel or more change, that is a recordable on the OSHA 300 log. Now, it's not quite that simple. Whoever's interpreting these audiograms also has to account for adjustment in age and also go back to a baseline hearing as well. So you want to make sure you have as many of the hearing tests as you can over time, and it has to be adjusted for normal uh, hearing decline as we age. Um, so when you get a shift like this, it's important to look at, is it bilateral? Is it on one side? And then look in the workspace and see what might be causing any change in hearing. If they're working in an area in the plant where there's not a high volume, a high decibel uh, uh, level of ambient sound, then once you've ruled out areas in the manufacturing plant, then you need to have the patient see their primary care doctor and see if there's an issue with a non-work related hearing loss, if they're like riding motorcycles or using firearms, that sort of thing. So there's a lot of variables to take into account when you're looking at hearing loss in the workplace. Um, as I mentioned, it's permanent once you have the hearing loss, and it can really impact someone's quality of life. It's hard for them. I don't know if you've probably been around a family member who's has difficulty hearing. They often feel left out of the conversations. They can't hear the conversations. They're too embarrassed to ask to speak louder. So often they'll sit there and pretend they're engaged and can't really understand. So they get a sense of isolation. And that can lead to some cognitive or mental decline. It can also lead to depression. They can also experience issues with ringing in the ears, which we call tinnitus or tinnitus. Um, and that can cause, trouble sleeping due to the ringing in the ears, trouble concentrating, which can also lead to depression and anxiety. It can become a safety issue if you can't hear well, in terms of if you're trying to walk across the street and you can't hear traffic. There's interesting data about the income potential is typically lower for a hearing impaired worker than a normal hearing individual. And just in a summary, as I mentioned, there's just the overall global effects are just a loss of enjoyment due to lack of hearing voices and music and TV and just things that you want to enjoy around you. If you can't do that on a day-to-day level, at a conversational level, at a conversational decibel level, it can cause some quality of life issues. So what do we want to do? Obviously, we want to prevent hearing loss. the best we can. So most manufacturers do have a hearing conservation program in place. Of kind of a fun thing to let you know, on a smartphone, there is a NIOSH sound level meter app that you can download onto your phone and see where you're at home or at work, what the decibel level is. Um, Obviously, to prevent hearing loss, we want to reduce noise exposure, try to cordon off or have barriers at work that may lower the volume, have time away from noisy areas at work. But main thing is we always stress is wearing protection for hearing to prevent hearing loss. I'm going to say it again. Getting your employees who wear hearing protection to prevent hearing loss is by far and away the best thing you can do. Um, the other thing that some safety managers do need to take into account, though, is there may be chemicals in the area that may be ototoxic to the ears. So, looking at your chemicals, looking at the safety instructions, making sure that that's not also impacting your employees' hearing. So what do? We measure our workplace noise. You determine how much noise reduction is needed. You offer your employees a variety of, excuse me, hearing protective devices. These are very common. You're familiar with these. There's different type of earplugs. There are banded hearing protectors and ear muffs. We are constantly telling when we are patients, your employees, when we see them in the office, the importance of wearing their hearing protection. We often stress using double hearing protection, using an earplug product with ear muffs to give them that extra protection, particularly if they work in a loud manufacturing setting or someone that, we know they're working somewhere a long time and they've been in that environment, or we see any change, even if they're in the normal range of their hearing audiometry testing, but changing a little bit toward that mild hearing loss, we definitely recommend double hearing protection in that instance. So you have the products available for them to use. You train your employees on proper use and care of the hearing protectors. And then it's important to validate the noise reduction that's obtained by the individuals wearing these. So there is a way, once the employee has these devices in place, to then check to see how much of that, decibel level is lowered when they're wearing their protective equipment. Um, so making sure you have a hearing conservation program in place, that you're doing hearing surveillance frequently, and that you are stressing to your employees the importance of wearing hearing protection. That is the main message that everyone needs to take away from this. Um, we can't stress it enough. And we do it when we see patients here at the clinic. So I hope this information's been helpful to you. This can get a little complex. There are certifications that we have that allow us to really interpret these results in more detail, to answer any questions that you have about that. But I hope that's been helpful. It's kind of a 30,000-foot view, but if you have any questions, or if you have a topic that you would like for us to discuss on a future video, please reach out to me. My email is Sandy, SANDY dot Hardee, HARDEE, at prismahealth.org, and I will definitely take your recommendation and hopefully do a video for you soon. Thank you for your time.